Hello guys, how are you doing? We're already a family of 200 members who are highly motivated, highly focused to reach their goal, that is cracking NEET PG 25. I'm your study partner, Dr. Himashri. I have already cleared my exam, but I want you guys to also clear this exam as soon as possible, because this exam process is not that good. Not that what enjoyable I can say. This process is always filled with stress, always the doubts from others, doubts from self. This process is very difficult. I guess they always say enjoy the journey, but the NEET PG journey, it's difficult. So okay, thank you for all the 200 subscribers who have subscribed to the channel. So without wasting our further time, because your time is really very valuable, let's start with our first question today. A 40-year-old male comes with the intracapsular fracture of femur. What is the surgery of choice? This is a simple question that has been asked in INICET November 24. The options here are open reduction internal fixation, closed reduction internal fixation, hemiarthroplasty, total hip arthroplasty. What do you think is the right answer to this question? Lately, intracapsular fracture of femur, intertrochanteric fracture of femur questions have become really very important, and a similar question has also been asked in the NEET 24, asking they gave this image and they asked what is this. This was the dynamic hip screw. It's a simple labeling type of question, but if you don't know that, you can't answer that question. So here, what do you think is the answer? I want all of you, if you know the answer, that's well and good, but if you don't know this and are confused, remember this flow chart at any cost. Take a sticky note, take a paper, just pause this video right now and note this. This is really very important, because continuously we are getting questions from this topic, so this becomes really very important. So here, neck of femur fracture, we need to see the age of the patient. If the age of the patient is less than 65 years, then we need to see when was the fracture, when did the fracture occur. If it is less than 3 weeks, we can do closed reduction internal fixation with cannulated cancellous screws. If it is more than 3 weeks, we need to do the MRA. If it is non-viable, we can fix and do vascularization procedures like Mayer's, Bakshi, fibular vascular graft. Viable head, fix and osteotomy like McCurry's, Powell's. If more than 65 years, do the replacement, hemiarthroplasty or total hip replacement. If hemi, in the case of previously normal hip, can Austin Moore, Thompson, bipolar. I'm just reading out this, but they simply gave a question from this topic only. They gave here the age of the patient is 40-year-old, and they didn't give the age of that, but age of the injury. But we can understand the surgery of choice over here would be closed reduction and internal fixation only. So if you remember this flow chart, if you memorize this flow chart, this question becomes really very easy. Coming to the second question, I want you to answer this question, because in orthopedics, in anatomy, this question has been repeated several times. This question has been asked several times also. I want you to answer this question in the comment section. During walking, the hip bone on the side of the suspended leg is raised by the action of which muscle present in the supporting leg? So this question is very common. This can be asked in other ways also, like the Trendelenburg gait. I guess you know this, so I want you to comment this below. The options here are gluteus medius, gluteus maximus, obturator internus and quadratus femoris. Coming to the third question, element lesions are associated with decrease in muscle tone, spastic paralysis, Babinski positive, fasciculations. What do you think is the right answer to this question? The options here are, in INICET, as you know, they give multiple option type of questions. So here he gave 1 and 2, 1, 2 and 3, 1, 2, 3, 4 and 1 and 4. LMN lesions, CMN lesions. During our final year, we like ratamaro this stuff, like this is for LMN, this is for UMN, because CNS examination we don't know. In the Viva they can ask this question. See, directly from the Viva he asked the MCQ over here. If you remember this LMN and UMN lesions, you can easily answer this question. So to answer this question, you need to know the findings in upper motor neuron and the lower motor neuron lesions. So in the lower motor neuron lesions, there is atrophy because the lower motor neuron affects the muscle only. So here the atrophy of the muscle is severe. Fasciculations are common. Tone is decreased. Distribution is segmental or distal. Muscle stretch reflexes are absent. Babinski sign is absent. Please take a book, note down these differences, because this can be asked in the next exam also, because it has been asked in the INICET November 24. We most of the times think that we need to read some fancy concepts or some fancy questions, but they ask the basic questions only. So we never should miss a basic question. Like here, the intercapsular fracture of femur is a basic question. This Trendelenburg sign, this one is also a basic question. Even lower motor neuron lesion question is also a basic question. If you are confident with your basics, you can easily answer these questions. So here, now as we read, lower motor neuron lesions, there is decrease in muscle tone, so this is correct. Fasciculations are present, so this is correct. But spastic paralysis, Babinski is absent here, so this shouldn't be in the option. So 3 we can easily rule out. 4 should be in the options, so 1 and 4 is the correct answer over here. Coming to the fourth question, the oxygen saturation with respect to PO2 is marked as A. What happens to the oxygen hemoglobin dissociation curve upon transfusion of stored RBC? You can see the image over here. So here they are asking the oxygen saturation with respect to A. What happens to the oxygen hemoglobin dissociation curve upon transfusion of stored RBC? So you need to interpret this graph. The options are what happens to the main oxygen hemoglobin dissociation curve? Where does it shift to? Will it shift to B, C, D or A? What do you think is the answer to this question? The oxygen hemoglobin dissociation curve is really very important. Another important topic. We read everything about the oxygen dissociation curve, and he asked this question in the exams. How do you feel? So you need to study everything regarding the oxygen dissociation curve. So we know that I used to always forget this concept in the while answering questions. So I noted down in my choti copy, that's the 20th notebook. So what happens, this is the normal sigmoid oxygen dissociation curve that we know. The curve shifts to the right to release oxygen, right, for releasing oxygen. Then when does it happen? Then the affinity for the oxygen is reduced in the case of increased temperature, when the pH is decreased, and there is increased PCO2 and increased 2,3 dpg. This we know. And also left side, the graph shifts to the left side when PO2 is low, pH is high, temperature is low, 2,3 dpg is low. And even in the case of fetal hemoglobin, here it allows oxygen, so the oxygen wouldn't be released from the hemoglobin. You know this basic concept, but you need to remember what he asked. To which side will the curve shift on transfusion of stored RBC? So in the case of stored RBC also, stored blood, that is stored RBC or stored blood, there would be a fall in the 2-3 bpg. In stored blood there would be fall in 2-3 bpg. Even if you know that in stored blood there is fall in 2-3 bpg, so the curve should shift to the left side. So the curve should shift to left side. Even you know this point, you can answer this question. Here the answer would be the left-sided one. So this question has also been asked in the NEET exam. So we need to learn this concept again. Here the answer would be B, because in the option B only the curve is shifting to the left side. You can also tell why not A, but oxygen dissociation curve is a sigmoid curve. Don't think about the A and D options because they are steep lines. They are not sigmoid curves. We are particular about the sigmoid curves only here. The fifth question, what causes decrease in GFR? Options, decrease in glomerular coefficient, decrease in glomerular oncotic pressure, increase in glomerular hydrostatic pressure, decrease in Bowman's hydrostatic pressure. Again, this concept is also important. GFR, we should know also how to calculate the GFR also. What do you think is the right answer to this question? If you think that you are confident in this concept, like I know how to calculate the GFR, pause this video now, think the answer to this and then resume and then start the video because this takes time. Okay, I guess you have come to your answer. This question is like if you know the concept, you can mark this answer right away. But if you don't know, it becomes difficult. The concept over here is, let's see, decrease in glomerular coefficient. For that matter, if you don't know anything about glomerular coefficient also, by ruling out the other three options, you can come to that answer. So let's see how more about this GFR now. So GFR, as you know, glomerular filtration rate, it's based upon the Starling forces. So the filtration occurs by the forces which favor filtration and also the forces which oppose filtration. So we have only one force, that is the hydrostatic pressure of the glomerular capillary, that's favoring filtration. This is the only one major force that is favoring filtration. That is PC, we can note it as 60 mmHg. And these other two, that is the oncotic pressure in the glomerular capillary and the oncotic pressure in hydrostatic pressure in the Bowman space, both of them oppose filtration. So the forces favoring filtration is the hydrostatic pressure, which leaks the water out of the system, and these two, oncotic pressure in the glomerular capillary, which makes the components to stay in the blood vessel itself, and the hydrostatic pressure in the Bowman space, which again pushes the fluid into the glomerular capillary. You know this. So remembering this in the exam is important. So whenever we increase the hydrostatic pressure, of course there would be increase in GFR, and whenever we increase the oncotic pressure, there would be a decrease in GFR, and also whenever we increase the hydrostatic pressure in the Bowman space, there would be decrease the GFR. So whenever we increase the forces which are opposing the filtration, there would be a decrease in GFR. Whenever we are increasing the forces which are favoring filtration, there would be increasing GFR. Here, if you want to increase the GFR, we need to decrease the oncotic pressure and decrease the hydrostatic pressure. It's as simple as that. Even if you don't know anything about the glomerular coefficient also, in this here you can answer this question. See, decrease in glomerular oncotic pressure. You know that glomerular oncotic pressure opposes the filtration. So if you decrease it, you can increase the GFR. And next option, increase in glomerular hydrostatic pressure. Even what we know about the glomerular hydrostatic pressure, this is the glomerular hydrostatic pressure which favors filtration. So if we increase the glomerular hydrostatic pressure, there would be increase in GFR. And third option, decrease in Bowman's hydrostatic pressure. We know Bowman's hydrostatic pressure opposes filtration. So if we decrease the Bowman's hydrostatic pressure, then also we can increase the GFR. So these all three options are causing increase the GFR, but decrease in glomerular coefficient. Glomerular coefficient is nothing but we have some formula for that. Kf is equal to something. You write, if you know that, write this in the comments section. In the exam, I was not knowing what is this glomerular coefficient, but I for particular know that these three cause increased GFR. So I marked the answer confidently that this is decrease in glomerular coefficient. So even by ruling out, you can assume. So I chose these 5 questions today because INICET November 24 exam has been so like everyone thought that the questions might be different because NEET PG standard was only increased. So August NEET PG exam was only difficult, might be November 24 exam might also be difficult. People thought like that, but as a banker, he gave all simple questions, all basic questions. Whoever are perfect with the basics were able to crack that exam easily. I was a bit overconfident. That's why I couldn't do that. I'll tell that story some other day. But see, so we might be thinking last NEET 24 exam was really difficult. So NEET 25 exam might be also very, very difficult. And we read all fancy concepts and difficult stuffs and forget to revise our basic things. Then what would happen? So don't do like that. NEET 25 can also be easy. He can only test simple concepts also. So make your basics straight. Whatever topics you are learning, learn with enthusiasm, like with a full concentration. Like even if you're not reading ortho or physio today, think while reading, remember my words that these concepts are important, and just get the things done. So as a study partner, my only wish is that you need to finish your daily targets completely. You need to be happy while studying also. Don't get stressed much. You are doing your best. Let's keep going. We can do this. And please like the video and comment to the second answer also, and share this video and subscribe to the channel. See you.